Contrary to popular myth, it is indeed possible to catch COVID more than once, and it might be more dangerous the second time around. Doctors warn not to overlook the risks of a second or third bout of COVID. Some studies show a second infection increases your chances of lots of health problems, and many second infections occur 2 or 3 months after the first. Doctors say a full series of vaccines is the best protection.
Lots of people think they have a license to do what they like after getting COVID once. But a British study suggests that Omicron is easy to catch again. You're 16 times more likely to get Omicron again in a short period than Delta. An American study on 5.6 million COVID cases found that 12% were a second infection and almost 1% were a third. Some samples even tested as the fourth time a person was infected.
After recovery, your natural immunity will begin to recede within 8 to 10 weeks approximately. Omicron is also prone to resisting vaccination, so the chance of reinfection is greater. People who get COVID 2 or 3 times have certain high risk factors. In our analysis, the number one risk factor is being HIV positive or having compromised liver or kidney functions, as well as being unvaccinated. This data reminds us all that even after having caught COVID, you must still note whether you might have immunity gaps.
Research shows that most second infections occur 79 days after the first infection. Third infections tend to come back faster. By round 3, the impact of the virus is worse. Patients report 12% higher stress, and the chances of heart or lung disease increase 5%. Risks for diseases of nerves and blood and the chance of diabetes go up, as well as the mortality rate. Almost 10% more patients will need to stay in the hospital.
If you get COVID again, where we see a big impact is in stress, because many symptoms or organs might be in a high-risk situation. After you get COVID, you should still go and get vaccinated according to schedule.
Patients are 20% more likely to develop long-term complications from multiple bouts of COVID. Doctors suggest getting 3 vaccine shots for the best protection. People are 68% less likely to need a hospital stay after their third jab.